Welcome to Compass Opioid Stewardship in Practice. Each week, our Compass coaches will explore a real-world case, define a clinical goal, and walk through practical strategies to improve care. Whether you're tuning in via video, audio, or reading the summary, this session is built for busy clinicians like you. Enjoy the show.
My name is Scott Weiner. I'm an emergency and addiction medicine physician, and I'm a coach in the Compass Opioid Stewardship Program. Today, we're going to review why Naloxone nasal spray is an essential rescue medication for patients prescribed high-dose opioids and how to counsel patients and their families on its use. Claire is a 62-year-old woman with osteoarthritis and chronic low back pain who takes hydromorphone ER 8 milligrams twice daily and gabapentin. This equates to approximately 80 morphine milligram equivalents per day. She occasionally uses a sleeping pill, temazepam, at night. She lives with her husband, who worries about accidental overdose. They've heard about naloxone, but they think it's only for people who misuse drugs. In this case, our goal is to educate Claire and her husband about the risk of opioid-induced respiratory depression and provide them with ways to obtain naloxone nasal spray so they are prepared to respond if an overdose occurs. Naloxone distribution is a key component of harm reduction. How to reach the goal. Step 1. Explain opioid overdose risk. Opioid-induced respiratory depression can occur with therapeutic doses, especially when combined with benzodiazepines or alcohol. According to several guidelines, patients taking more than 50 MME per day or co-prescribed sedative hypnotics like benzodiazepines should be offered naloxone. People age 65 or older or with comorbid lung disease, kidney or liver impairment, or sleep apnea are also at increased risk. Step 2. Describe naloxone. Naloxone is an opioid receptor antagonist that reverses respiratory depression within 2 to 3 minutes. It's safe and has no abuse potential. More than one dose may be required when potent opioids like fentanyl are involved. And note that if the patient is taking chronic opioid therapy, naloxone use in the absence of overdose can precipitate uncomfortable withdrawal. Step 3. Discuss availability. Naloxone nasal spray is available over the counter in all 50 states and is sold at pharmacies and grocery stores. Many insurance plans also cover the prescription version, sometimes without a copay. Cost does vary by brand, but community programs, cities, and states often provide free kits. Carrying naloxone is no different than carrying an epinephrine autoinjector for allergies. Step 4. Identify who should carry naloxone. The CDC recommends naloxone for anybody at increased risk of opioid overdose. People taking more than 50 MME per day, combining opioids with benzodiazepines or alcohol, using non-medical opioids including fentanyl, or with a history of substance use disorder. Family members and caregivers of these patients should also learn how to administer naloxone. Step 5. Teach that administration and follow-up. Show Claire and her husband how to use naloxone nasal spray in the case of an overdose. You peel back the package, you insert the tip into one nostril, and push the plunger. If the person doesn't respond within 2 minutes, give a second dose. And in either case, also call 911. After administration, stay with the person for at least 4 hours until help arrives. Emphasize Good Samaritan laws that protect rescuers from liability. Encourage them to let relatives and friends know about the naloxone and where it's kept. The clinical pearls we want you to remember are, number 1, offer naloxone to patients on more than 50 MME per day or on opioids plus sedatives. They are at high risk for overdose. Number 2, naloxone reverses opioid-induced respiratory depression within minutes and is safe even if the person isn't experiencing an opioid overdose. Number 3, naloxone nasal spray is now also available over the counter. Ensure patients and caregivers know where to purchase and how to use it. Number 4, teach caregivers to administer a second dose if the person doesn't respond within 2 minutes, and always call 911. Number 5, encourage patients to share naloxone location with family and friends and to avoid combining opioids with benzodiazepines, alcohol, or other sedatives. By equipping patients and their families with naloxone, we empower them to prevent fatal overdose. As clinicians, we must normalize harm reduction strategies and integrate them into our routine care.
This show has been brought to you through the generous support of the Centers of Medicare and Medicaid Services. Thanks for joining this week's Compass Opioid Stewardship in Practice. Thank you for being part of the Compass Opioid Stewardship Program, and thank you for all you do caring for your patients. See you next time.